Good afternoon, our distinguished guests, senior, juniors, and my colleagues. My name is Capt Htet Wai Moe. I would like to talk about research on herbs for COVID-19 battle for this symposium. This is the outlines for my presentation. The COVID-19 is caused by severe acute respiratory syndrome coronavirus 2. It's a new form of virus, and the pathogenesis or disease causation is not fully understood so far. So various prevention and treatment options for COVID-19 are vigorously evaluated nowadays, and the herbs and natural compounds are one of them. The herbs and natural compounds are being used since antiquity, and they have made significant contribution for prevention and alleviation of various diseases. And some of the historically used herbal remedies have become modern medicines because they are feasible, cost-effective, and efficacious. And most importantly, many people believe that they have minimum side effects. So various professional bodies to evaluate and applying the plant-based therapeutic approaches were established in other countries such as Ayush in China, India, the CHM in China, and the Persian and Romanian medicines. The beneficial impact of the medicinal plant lines in the bioactive phytochemicals, which can be extracted from medicinal plants such as terpenoid and polyphenols. And active plant metabolites were extracted from various plant sources such as ginger, clove, and black pepper. The plant metabolites which were extracted from the plant sources were found out to have the ability against the coronavirus, such as terpenoid, which can modulate the cellular metabolism, specifically the synthesis of steroids, and they show the significant antiviral activity. The polyphenols and flavonoids can also trigger signaling pathway, and they are identified as potent COVID-19 protease inhibitors in silico study. The dipeptides and polysaccharides were also found out to have the uh, ability against the COVID-19 virus. Due to these plant metabolites and herbal products, various natural products were undergoing the later stages of clinical trials, such as phase 2 and phase 3. As can be seen from this table, the acacia bamberry extracts is undergoing the phase 2 of the clinical trial, and it has shown um, the ability of inhibition of the nod-like receptors, which is an important inflammatory receptors in the COVID-19 early infection. The Nigella sativa is undergoing phase 2, which show the potential for immunomodulation and antiviral activity. The gam arabic powder and the combination of artemisinin, curcumin, boswellia, and vitamin C are also showing some action against COVID-19 virus. Here in this table, the natural products that are undergoing phase 3 of the clinical trials. So they have the better potential to be utilized for COVID-19 battle. The Nigella sativa and honey combination showed the immunomodulation, antibacterial and antiviral activity. And natural honey also have various activity against the COVID-19 virus. And in China, they have the combination of traditional Chinese medicine, which is being utilized and being studied in the phase 3 trial. It has also been uh, found out that they have multiple activities. This table shows the researchers on Harvard formulation, which can be utilized as a therapeutics against COVID-19. The cannabis sativa showed the anti-inflammatory action by modulation of gene expression of ACE2 enzyme. The ACE2 enzyme is one of the most important enzyme for coronavirus replication and internalization into the host cells. So They might be used as an adjunct therapy. And one good thing about the cannabis sativa is that they can be utilized as mouthwash and throat gargle. The glyceryl glabra also shows the ability to counterbalance the activeness of COVID-19. The citrus species, which is very common in our country, they also show the potential uh, for porphyrinization treatment of COVID-19. The porphyridium species were also having the potential uh, to be used as a coating material on the sanitary item for COVID-19 prevention. These various plant species were in the pipeline being investigated to be used as possible therapeutics against COVID-19. The various species show the antiviral capacity or the resistance against COVID-19 virus, and they have the ability to bind to COVID-19 and inhibit the replication. The Lawsonia innamis, then Nidoscoles actinofolius, Scutalaria, Bicalensis, and Eleven sativum, the Ginkgo biloba, Azocarpium citrigrandis, Eucalyptus species, Betula pubescens, which are all common plant species which can also be seen in our countries were being investigated as possible therapeutics against COVID-19. So here in our country, we have also conducted a research at the Defense Services Medical Research Center. The five common harvest plant extracts that are extensively used in our country were studied for ability against COVID-19. The ginger, licorice, cinnamon, turmeric, and neem were investigated. It was a laboratory-based experimental study which was done on Western albino mice of both sexes. The aqueous extraction was done from these plant extracts from these plants, and the immunomodulatory activity was evaluated. From this study, it was found out that the ginger can enhance the level of IgM and monocytes, the licorice can increase the level of IgM, and then cinnamon can enhance the suppling index, and the results were statistically significant. So the aqueous extracts of ginger, licorice, and cinnamon might be employed to boost immune system, and so they hold the potential for further experimental and clinical investigation to be used for COVID-19 management. These photos show the aqueous extractions for the study, and the left photo shows the oral feeding on extracts. The avino mice were fed with extracts from five common Myanmar traditional plants for 14 days consecutively. After 14 days, the blood collection was done by cardiac puncture, and the blood was analyzed for total blood count and IgM and IgG concentration. So to conclude, the COVID-19 disaster was is still ongoing, and it demands the discovery of effective drugs. And the how medicines are being used since antiquity, and they prove to be promising alternative for prevention or treatment of COVID-19 infection. So more research need to be conducted in a more elaborate manner for COVID-19 battle. These are the references used for my presentation. Thank you for your attention.